In its 20-year existence, Baystate Health System has experienced steady, managed growth, adapting to the changing landscape and unpredictable forces of the world. Through vision, passion, and innovation, Baystate Health System has become a nationally recognized healthcare organization, a leader in the state on many fronts, and the premier provider of health services in the region. Above all, it is the unwavering dedication of Baystate Health System's people to do the very best they can for patients, families, and their communities that has kept the organization focused, resilient, and strong. To act, to dream, to plan, to believe. This is the story of Baystate Health System.
I joined Baystate Medical Center in 1981. It's been 22 years of constant change. When I first arrived, it was to become CEO of the medical center. The first 5 or 6 years, our concentration was on bringing together the various cultures of the Springfield Hospital, the Western Memorial Hospital, the Western Women's Hospital.
Our initial vision was that when Mike Daly was hired, that he would bring together a management team that would help turn 3 excellent but very different kinds of hospitals into a unified medical center that would provide outstanding and yet cost-effective medical care for the entire region. One important measure of the success of that effort, we determined, would be that people who used to say, you know, if you had a major medical problem, you had to go to Boston, would conclude that they didn't need to go to Boston and that they could retain the kind of wonderful care they needed right here.
When Mike Daly arrived at Baystate Medical Center, we were a big, good, community-oriented medical center. We had the earliest evidences of being an academic medical center. But I think Mike's vision of recognizing that for us to go from being a good healthcare providing site to a true medical center and a regional treasure, we needed to move forward on the academic side of the equation.
It really all came together with the construction of the Centennial building in the mid-'80s. And when we finally put all the organizations under a single roof and had everybody working side by side, I think the vision of what Baystate Medical Center could become actually started to happen. The next period of time was the creation of the Baystate Health System. So we went simply, from the Baystate Medical Center to a much larger vision. And that vision was to serve the 3-county region of Hamden, Hampshire, and Franklin. We added the Franklin Medical Center and the Mary Lane Hospital to the Baystate Medical Center and truly became a multi-hospital system. And we actually were the first multi-hospital system created in New England.
Established by the move that we've announced today, that we think that in this area there are good reasons why we would like to establish a network of services.
In the mid-'90s, the leading thinkers in healthcare in the United States developed the concept of integrated delivery systems, which recognized that healthcare really went beyond the acute care setting. And so we created the integrated systems strategic plan and then added the visiting nurse associations and started to construct primary care practices throughout the region and literally developed a continuum of care services whereby Baystate, under a single umbrella, could offer healthcare services to families and people literally from birth through death.
The past 20 years at Baystate has also been characterized by an immense amount of building. If we simply look at building of new facilities over the last 2 decades, I'm not sure that anyone would have predicted how much would have gone on.
I've witnessed extraordinary growth at the Baystate Health system on North Main Street, as well as just across the street from where I live. I think that the growth has been good for our neighborhood, and I think that the growth has been good for the North End. Baystate's growth has literally changed the complexion of that area. When you consider where we live now and how our people make a living every single day, it's pretty basic. It's financial services, it's healthcare, it's education, and the remnants of manufacturing. That's where the people of the Pioneer Valley, Western and Central Massachusetts now go to work. The engine of growth in large measure has been the healthcare providers. They've done a remarkable job, and they're good jobs with good wages.
Mike's genuine concern for the well-being of the communities that we serve has always been evident. I think his recent emphasis on economic development in the region is good for Baystate and is good for our community.
If we look back over the last 2 decades, I think a very significant feature of the growth and development of our medical center has been the increase in clinical and research programs. I think the recognition was that not only did we need to have strong education programs, which certainly developed in the first part of the 1980s and through the 1980s, we also realized that research was very important in stamping us as an academic medical center. And indeed, that's happened. I think if we look at the statistics on the numbers of grants and the numbers of grant dollars that have come in over the last 2 decades, it's a striking increase.
Everything we have done in the last quarter century has emphasized partnership. No one single component of this organization was going to overbalance or outweigh the opinions of the others.
One of Mike's goals has been to get the physicians to be a partner with the hospital and to link into the hospital intimately. And it's more than just he said it, he's actually accomplished it in what he's done. Mike, many years ago, put together Health New England. He had a vision of what it was going to be, but he insisted that the doctors be partners in this venture, and it was successful because of that. And I think he led the way to show people in the hospital that if they partner with their doctors, they will get ahead. Mike did the same thing with the Baycare Health Partners. He had a vision of where a PHO should be, which is a physician hospital organization, and he insisted that it be an equal partnership with the doctors. And because of that equal partnership, a relationship developed with the doctors, a trust developed, and I think that spread out across the whole system and was successful.
The University of Massachusetts at Amherst is a wonderful research institution. Baystate Medical Center has always been an excellent clinical institution, and combining the forces of the two organizations is creating a partnership that is really a potent force in terms of academic development, research development, and ultimately in terms of economic development. That's going to be very important for the Western Massachusetts region.
If you simply look at our 5 centers of excellence, the cancer program, minimally invasive surgery, the cardiac services, women's services, and the joint replacement program, those are 5 fairly dramatic programs which provide state-of-the-art care, very sophisticated, well-trained, highly dedicated professionals. If one recognizes how the services we provide in the emergency department, in our laboratory services, our radiology, we are truly right at the cutting edge. And that has occurred over the past 20 years, so that the programs have really now rivaled those in all of the major medical centers of the country.
Baystate Health System is not only surviving but thriving despite the significant challenges that exist for hospitals regionally and nationally. And the reason that's so is because we've taken such a deliberate approach to planning from a financial point of view.
Good strategic planning is what distinguishes a mediocre organization from one like ours, which is extremely successful. It's because of Mike Daly that we have an advanced and sophisticated strategic planning process. And the fact is that our organization is very successful, not because of good luck, but because of sound planning.
We've created a values-driven organization. Every single employee who comes to Baystate understands our values, respect, integrity, trust, collaboration, communication. All of those things have deep meanings for all of us. But the bottom line is always that our people are really focused on the patients, and that's what drives them. That's why we attract great people.
Baystate will obviously continue to be the preeminent provider of health services in the region. We'll evolve to bring ever more specialized and sophisticated services to our communities and to our patients. I also believe we will be the leader in developing a network of care where sophisticated and specialty services are more broadly shared across the region, where we leverage technology to integrate services for patients across multiple providers and multiple services. I think our reputation in research will be greatly expanded over these next number of years. I believe that Baystate will be a partner and a driver and a participant in a virtual explosion of biotechnology development in our region. And I think that Baystate will be known in the very near future as one of the absolute best workplaces in the northeastern United States.
Baystate's great already, but it's even going to be greater as long as all of the pieces, all of the critical components of this organization continue to know one another, work with one another, and share the same vision, the same values, the same culture, and all do today and all work in the end toward the better care for the patient.
I think we'll change over time. We'll look for new markets, new programs, new services, new opportunities as they present themselves. But generally, we're very confident in this path that we're on.
We live in a rapidly changing world, and there's a new era coming. The new era is under a great leadership of Mark Daly, and I think he will build upon what Mike has developed.
Mark's been involved in all of the decision-making for many years. Mark's been here for 11 years. We could not be more blessed as an entity at a transition point to have someone like Mark Daly on board. His compassion, his intelligence, and his same sense of teamwork that Mike had, Mark has. And Mark will be another great leader for Baystate Health System in the future.